Welcome to Lipstick and Lipo. I'm Dr. Smita Ramanathan, board certified plastic surgeon, and we are all about giving you and delivering unfiltered information about plastic surgery. And I'm joined by my dear friend.
I am Dr. Ashley Malfi. I'm a board certified plastic surgeon in Rochester, New York, and we are so excited to be here with you today for Lipstick and Lipo. And we are answering like one of the most common questions we get. So this is not even just like an office question. This is like cocktail party,
This is a
dinner
dinner party
party,
question. Yeah,
graduation party question. This is just like your friend from high school that you run
right.
into. Everyone wants to know if they should wait until they have kids to get a breast augmentation.
Yeah. Yeah,
What do
I
you
mean, it
what do you
comes
tell
up
them, girl?
all of the time. I mean, I tell them, no, they don't have to wait. And I think it completely just depends on your personal goals and where you are in life, right? I mean, I think we both see patients that are in their 20s coming in for breast augmentation. Having kids may or may not be on, in their immediate future. And I think it's totally okay to do that. I would say if you are planning a family within a year or two of
Yeah.
having your surgery, then it might be best to wait.
Yeah.
But it's, a completely personal decision. Both
Yeah. I
options are
mean, yeah.
totally fine.
We see tons of young people for breast augmentation. We see so many girls who are, like college age in their young
Right.
20s and they just have always wanted a larger breast since they went through puberty. And there's no reason you have to wait a decade or so to do that.
Mm-hmm.
Absolutely enjoy yourself, get a breast augmentation, feel good and confident and comfortable in your own skin. And then if you're going to have a child, things might change. And that's totally okay because with or without an implant, they're probably going to change anyways, right? You're going to,
Exactly.
your breast size might go up, it might go down, they might get saggy, they might not. Um, you might need different things after you've had kids, but that doesn't matter. If you have a breast implant, like those changes are all possible either way. So you might
Mm-hmm.
as well do whatever it is that you want to do so that you feel really good. And if that's a breast augmentation, absolutely. We're happy to
Yeah.
do that. And
Right.
it's safe. It's
And it's
totally
safe,
safe.
right? I mean, and I think that's the thing, right? It's a totally safe procedure, right? I mean, there's things that we talk about for, what do you tell patients about breastfeeding, for instance?
I
Because that
tell them
comes up.
absolutely they can
Yeah.
breastfeed. Yeah. I think, with a breast augmentation, you might have some injury to the ducts, but compared to all the other things we do, very little. And so I usually tell them
Yeah.
that might need a supplement, but with a breast augmentation alone, I think that that's actually really unlikely as, compared to lift and reduction and other procedures like that are more invasive. And breast milk is also really safe. People worry, is there silicone in
Yeah.
breast milk? Well, the reality is there's actually silicone in formula off the shelf, and there's actually greater amounts in formula off the shelf than there actually is in the natural breast milk of a woman with silicone implants, because the silicone's not in the ducts. The body just makes a little scar tissue around it, and that's it. It forgets it's ever there. So it's totally safe. People always, I think, worry that they're doing something harmful to their baby, but they're not. It's
Right.
absolutely safe to breastfeed. Is
Yeah. It
that
is.
kind of what you tell them too?
Yeah, I mean, I do tell them with any sort of surgery on the breast, whether, we're doing augmentation or a lift, there is always a risk that you might not be able to
Mm-hmm.
breastfeed, right? Because you are operating on that area. That risk is less with the augmentation, especially if we're going under the muscle. But more often, you're producing milk, just not enough, and you have to supplement at some point.
Mm-hmm.
So I think I do have that discussion with people because I know for some people, it's very important for them. They don't want to do anything that would put them at risk for not being able to breastfeed. So in those situations, maybe wait, right?
Mm-hmm.
But then again, a lot of
You never
patients
know.
can't breastfeed without doing
Yeah,
anything.
exactly.
So at the end of the day, it's safe to do. It's safe for your baby if you do choose to breastfeed and you're able to. But the whole point of this is to sort of feel confident in your body. And if having that breast augmentation is going to give you 5 years, 10 years, however long before you choose to have a family, if that's what you choose to do, then go for it. There's
Yeah.
really no downside to it.
Yeah, absolutely. And so the timing is everything, whenever it seems like a good time for you, I think that that's totally fine. Even if you are going to have kids in the next 2 years, I think, if that's something that's really important to you, it's really all about your priorities. And as long as you know that it's safe and that nothing bad is going to happen to you down the road, then it's just a matter of, is this something I really want? Is this something that's going to make me feel really good? And if so, you absolutely could do it.
Right.
And then, down the road, when you see moms who've had breast implants younger, the reality, Smita, right, is that we do see them after they have kids, but we see all women after they've had kids and
Right.
they have changes to their breasts. So I don't think it's any more.
No.
It's just what happens after having children or
Right.
breastfeeding or any of those experiences.
Right, exactly. Your body's going to change regardless. And yes, if there is an implant, right, there are other things that we have to sort of look for, down the road. But that's whether you got the implant at age 25 or you got the implant at age 45, right?
Exactly.
So it's completely safe and it doesn't really alter sort of what the changes that your body goes through, other than you have an
Right.
implant in place, right? But the normal body changes and breast changes are going to occur regardless,
Right. So you
right?
just see where you're at when you're all done, and we would have seen that either way. So you really haven't
Yeah,
done anything differently, and you've gotten to enjoy them that much longer.
right. That's the key
So,
there, right?
yeah. So that's a really positive thing. And then down the line, after kids, people want to lift, or, sometimes people want a different size implant because their body's so different. And, oftentimes it's been in there long enough that it's kind of a reasonable time to exchange that implant anyway. So for a lot of my patients, the timing works out really well. They get it
Right.
their first pair and they have a good go of it. And then their body changes after kids and they're ready to do a mommy makeover, to do other stuff anyways. And then we're going to just reevaluate their breasts and their implants and pick something that is good for them at this point in their lives. So
Right.
that's very, very common.
Yeah, yeah, exactly. So, I mean, I think if this is something that you guys are thinking about, obviously talk to a board certified plastic surgeon, get all of your options, learn about sort of everything that we're discussing today, and then decide if that's the right decision for you based on sort of your time frame for having children if you choose to do so. But it's
Yeah.
perfectly safe, and we see a lot of our patients that are young and sort of want to do this for themselves.
Yeah. Don't stress. If you want to do it, girl, just do it.
Just do
Feel good.
it.
And then we'll figure it all out later. But yeah,
Exactly.
it should be a positive thing. Don't stress about this. This is an absolute yes. You can have a breast
Yes.
augmentation before you have kids. So we're happy to talk more about this. Breast augmentation is like one of our biggest topics. So there'll be lots
Yeah.
more here, but we hope we answered this one quite clearly for you guys. So thanks for tuning in. Subscribe to Lipstick and Lipo, your unfiltered guide to plastic surgery.
See you later, guys.
Bye, guys.